Aye.
This item passes unanimously.
Thank you. Thank you, Director Morales and Assistant Director Cantrell Warren. We have one last item on our agenda before we go into closed session this morning. I believe it'll be brief, and in respect to the health staff that is here, I think we should move through and address it now.
Right, I'll jump in if it's okay with folks. And
sure.
I do have...
And this is item 10, to consider a report from the Health Services Agency on the Syringe Services Program as directed by the board on June 8, 2022, as outlined in the memorandum of the Director of Health Services. And for a report on this item, Monica Morales.
Thank you. Joining me is Emily Chung, our Director of Public Health, and also Dr. Newell. Let me just get right in and wanted to just provide an update. I know at our last meeting in June, you tasked HSA to come back and provide an update and potential additional 8 syringe disposable kiosks opportunities across the county. So in your report, what you'll see is we provided 8 sites, 4 in Watsonville and 4 in North County. You'll see the actual list of where these potential locations can be. I will just remind folks that these were recommendations from our community and also our SSP Advisory Commission. However, we really need to test for feasibility with our jurisdictions to ensure that it makes sense for them and the key organizations that we have outlined there as well. You know, looking in terms of the cost for what it would take to move forward with these new 8 kiosks, we're looking at about $52,000 for a one-time expense. And then for maintenance, we're looking at about $40,000 annually moving forward. Also want to remind you that in the report, you'll see some data. You asked us to come back and share with you some of the data as it pertains to the litter syringe pickup. And so what you'll see here is that overall, you know, some of the data over the past 2 years remains consistent. We have key sites that we've been collecting data from, and we are trying to get better at the data collection. I want to highlight that it's an effort for us. We're trying to work closely with the Downtown Streets team, Save Our Shores, and even including our own syringe program to make sure that we are collecting data, that we're reporting it, and also looking at trends over time. But in general, what you'll see is that our Downtown Streets team, as a collaborative, they're collecting about anywhere from 0 to 150 syringes across their sites. Our Safe Shores are collecting anywhere between 2 to 26 syringes. Again, these are monthly. And then you'll see for our county SSP exchange sites, over the past 2 years, we have seen a downtrend, but it's still a significant amount of needles that are being collected by our team. So I want to kind of just summarize, thank everyone that has helped put this proposal for you in terms of potential 8 sites and the data pieces, and also just really emphasize the work that we still want to continue with the local cities to make sure that this is a successful program. So with that, I'm going to pause. I know there's much more that we can cover, but I'll leave it at your leisure for questions.
Thank you, Director Morales. Are there comments or questions from members of the board? Supervisor McPherson?
Mr. Chair, I know you and I attended a community meeting recently with neighbors in the M1 facility, and where the county conducts a Syringe Exchange program and provides other health services to vulnerable populations. And I want to acknowledge the concerns of those neighbors that we heard from. They were very measured and polite, but they do have some serious problems, and there's spots throughout the county, but in that region, it's significant. And I'm just concerned about the decreasing use of our SSP and related decline in the distribution of clean needles offered by our SSP. We've seen a steady decline in recent years, as you mentioned, and I think the board members of the public would benefit from a deeper dive on this issue, which I know that you're looking into. So could someone from the Health Service address that issue briefly now, and perhaps we could have a bigger discussion about it during the next update, whenever that may be?
Yeah, absolutely. Part of it for us is also we're looking at the data. We're talking to our community constituents to see what's happening. We believe it could also be linked to the harm reduction sites that have been scaled. And so folks have more options in other places of the county. We're also looking at potentially the impact of COVID and accessibility in some of our sites. But I'm not sure if, Emily, you want to add anything else to this finding?
Thank you, Director Morales. Yes, those are some of the key issues that our teams are experiencing is additional exchange providers in our community, as well as there are reports that injection drug users are now switching to smoking instead as a means of drug use. And so there is a shift in modality that may be impacting the syringe needs in our community.
Thank you, Supervisor McPherson. Any other, Supervisor Kennedy?
Sure. So first of all, I want to take a moment and thank Director Morales for meeting with Supervisor McPherson and myself to talk through some of these concerns. I think the 8 kiosks are a good step in the right direction, and I appreciate you pointing out that you have to work with the community and our jurisdictional partners to make that go. I do think that the decrease in the numbers of our program, which we've had many presentations over the years I've been here, is incredibly effective and reduces harm and connects people to needed services is deeply concerning. I think the more that data that we can gain about HRC's distributions, which are clearly having at least some significant impact on our system and potential litter is great. And then finally, I will reiterate, just yesterday, leaving the county building over the Water Street Bridge, there were 5 needles sitting on the bridge, 20 feet from a kiosk. And so needing to have an ability for those needles to be quickly and safely picked up is incredibly important.
Thank you, Supervisor Kennedy. Any other comments or questions from board members? Then I'll add, thank you for the data-driven approach here. And I'm fully supportive of adding an additional 8 kiosks, considering how many needles those kiosks have taken off our streets. And 60,000 in 1 month is a pretty remarkable number, and much better in one of those bins than on the streets. So I appreciate that. I share Supervisor Coonerty and McPherson's concerns about the decreasing utilization of our county exchange program. As Supervisor McPherson said, we did have that meeting with neighbors who are around the Emmeline Clinic. I think there's a couple issues there. I mean, not only the direct impacts to the residential area, but also co-location with folks, giving out syringes at a place where people are also trying to receive medically assisted treatment and really get away from old patterns. I'm certainly reached out to our sheriff's office and working with city council and the police department to ensure that we are stringent about, and make sure that there's no illegal activity happening in the area, as we've heard repeatedly reported by residents. So, I'm supportive of adding the 8 kiosks. I'd also like to ask that our Syringe Services Advisory Commission look at the possibility of moving the North County Syringe Services Program out of Emmeline and look at whether it's another physical site like HP at Coral Street, or I know we have new HP mobile vans, looking at utilizing that as a potential way to operate the program as well. All right, if there's no other comments or questions by board members, is there anyone in the public who wishes to address us on this item? Is anyone here in chambers? Is there anyone on Zoom?
We have no speakers on Zoom, Chair.
All right, then I'll return it to the board for action.
Recommended actions.
Second.
All right, and just did you want a question about the asking our Syringe Services Advisory Commission to look at the location of the Syringe Services Program in North County. Do you think that is that something you're
I think
able to?
that would be, thank you, Mr. Chair. I would like to add that to the motion to have our advisory committee look at that.
Okay, thank you. Is that amenable to the second? Supervisor Coonerty?
Sorry, yes, it is.
Okay, then motion and a second with additional direction. Any further discussion? Seeing none, clerk, roll call vote, please.
Supervisor Friend,
Aye.
Coonerty, Caput,
Aye.
McPherson,
Aye.
and Koenig.
Aye.
Item passes unanimously as amended.
Thank you.